Thank you, Mr. Speaker. It is our pleasure during the next 40 or so minutes to express concerns about a Medicare program that has served this nation's seniors so very well for 45 years and is at risk of being ended. Tonight we witnessed on this floor the third such vote to end Medicare by the Republican majority. And we know that our seniors would be forced to shop in a private market. The certainty of a guaranteed program that has been available to our nation's seniors since 1966 is at risk. The money that the government would kick in for coverage would not keep pace with the costs for those health care policies, and so our seniors would be forced to dig into their pockets, reach into those pockets, and perhaps have their costs, their contributions more than doubled. This is an unnecessary step that is being taken against our nation's seniors that is irresponsible. We believe that what we have seen since that threshold in time in 1965 when we approved such a measure, the impact from the private sector healthcare industry has witnessed a growth of over 5,000% in the cost of premiums in that time since 1965. The impact on seniors has been certainly far less than that. We have seen the containing of administrative costs. We avoid marketing requirements with the Medicare program, and we have been able to share benefits with our nation's seniors in a way that protected their health care coverage, that enabled them to enjoy a quality of life. It can easily be documented that when our nation's seniors retired back in the 60s, they would see their economic durability challenged, their strength, their economic opportunity to grow forward into retirement was oftentimes impacted by the cost of medical needs. There was cherry picking going on. There were opportunities that were denied our nation's seniors, and they were asked to absorb an amount of pressure in order to continue forward in soundness, in wellness, and certainly to have the coverage that was required to meet their health care needs. All of this now is at risk with several proposals. We've seen a Ryan plan, a budget that the Republicans produced, the Ryan road to ruin, as we've designated. It would cause severe hardship on our nation's seniors. We saw the Republican Study Committee come up with a vote that, again, ended Medicare. And today, when we witness this attempt to play with the United States Constitution to make it very easy to end Medicare while making it even more difficult to address those deep pockets that get favorable treatment by some, go continuing on because it would be more difficult to end that opportunity. So what we have here tonight is an opportunity to discuss the assault on America's working families, the assault on her seniors, the nation's seniors, by ending Medicare that puts the private sector insurance industry in control. They put them in the driver's seat. They require our seniors to shop with a voucher that won't nearly cover the cost of those premiums, and again, require them to pay double as we go forward. We're joined by Representative Garamendi from California here this evening and Representative Joe Courtney from Connecticut. And the three of us will share thoughts about how to better address the economic pressures on this nation today without ending Medicare. It has been a lifesaver for so many of our nation's seniors and has provided a sense of security, a predictability in their budgeting as they go forward in retirement years. Representative Garamendi, John Garamendi from California, thank you for joining us this evening. And you witnessed it here tonight, as Ms. Nee and I both did. Representative Courtney from Connecticut and I witnessed yet another vote that would mean the end to Medicare, because it's an attempt to play with the Constitution, mess with our Constitution in a way that would really focus on hardship for our nation's seniors.